Now we're going to talk about the functions of the skin and then some of the disorders of the skin. Some of these things we've already talked about. The skin has a lot of and very important functions for the body. Probably the biggest one just being protection. So this houses all of our other organs. It's the first line of defense against anything that's going to interact with our body in our skin. So the pathogens, keeping out viruses, bacteria, all that sort of stuff, that's our skin. Also UV rays protecting us from, so UV radiation is dangerous, and so our skin is there to protect us, and then also from trauma. Skin also helps us regulate our water. So because we don't live in water, we live in a dry environment, so we're constantly losing water to the environment. And so our skin is waterproof, so it allows us to regulate that water that's being lost. It also does function somewhat in getting rid of waste, including water, but other wastes such as urea, as we mentioned when we talked about the sweat glands. Not one of the major functions, but it is a function of the skin. This one is important though, producing vitamin D. So our skin, we have a mechanism in our skin that when it is exposed to UV, even though UV radiation is kind of the catch-22, I guess, but even though UV radiation is dangerous, it is what allows us to produce vitamin D, which is essential to our body. So there's kind of this balance here. So on one hand, we're trying to protect our body from UV radiation. On the other hand, we need it to help us produce vitamin D. And something interesting here is the melanin, which protects us from UV radiation, also makes it more difficult for us to produce vitamin D. So there's this balance here. So if you have darker skin, then more exposure to the sun is going to be needed to produce vitamin D. If you have lighter skin, then you don't need as much exposure to the sun to produce vitamin D, but you got to limit your exposure to the sun to prevent UV radiation from causing damage to your skin and skin cancer and things like that. So there's balance. Really though, nowadays we spend so much time inside that probably all of us need more vitamin D or need more exposure to that UV radiation to help our body produce that vitamin D. So I don't think we spend enough time outdoors nowadays. So anyway, just something to think about. Reason vitamin D is important is because it prevents rickets. The rickets is a disease sometimes known as bendy bones, or bones that are not strong. You get these. So this is a normal individual here, nice straight strong bones. This is an individual that has rickets, so the bones are flexible because there's not enough calcium in them, and so you get these bowed legs and things like that. Not good. So vitamin D is very important. Our skin also helps us interact with the environment. So this is where a lot of our nerve endings and things, stimuli are, and information is gathered from our environment and sent to our brain, so we can decide how to interact with our environment. And then body temperature regulation. We're going to talk a little bit more about body temperature regulation because this is an important function. So our body has to maintain a certain temperature. If we get, so the average person 98.7, of course that's just an average. So there is some variance around that's okay. But generally if we get up above 103 degrees Fahrenheit in our body, then we're going to start to have problems if that's prolonged. 104 is kind of that, 103, 104, that's kind of that line that we're trying to avoid. And so our body has to have a mechanism for reducing heat, because as we metabolize, we're naturally producing heat. As we produce ATP, as we go through cellular respiration, if you remember those terms, we're producing heat, and so our body naturally heats up. So what happens is our body temperature rises. There's a few mechanisms that go to help us try to maintain that homeostasis, to get back to that body temperature that we need. The first thing that's going to happen is our blood vessels in our skin, in that dermal layer of our skin, are going to dilate. We call that vasodilation. So they're going to dilate so that there's more blood going to the skin. The reason this is important is because there's more surface area on our skin, so as the blood vessels are near the surface of our skin, we're going to be able to release more heat into the environment. So that's an important thing. So when we get too hot, blood vessels vasodilate. When we get too cold, they constrict. So there's that interplay there going on. And then our sweat glands are activated, and we start releasing sweat, which helps to cool our body. When our temperature gets too low, we have the vasoconstrictions we talked about. Sweat glands are not working, and then we also have shivering. So shivering is when our muscles are contracting, and as they contract, that's producing heat. And so shivering is a way for our body to try to produce more heat when we're too cold. And then also the erector pili muscles are going to contract, as we talked about, produces goosebumps. Doesn't really help us necessarily, but it is a response to lowering our body temperature. If our body temperature gets too low, we get hypothermia. Hypo means below, thermia below the body temperature. And so when we get too cold, our body is no longer able to function. Things start to shut down, and then if we stay too cold for too long, then you can pass away from that. Hyperthermia, hyper means above, so hyperthermia is a body temperature that's too high. And this can lead to heat exhaustion, can lead to heat stroke, both of which can be fatal. And then we can also have this situation when we're fighting some sort of pathogen. Our body can have a fever, and so fevers are actually a good thing if they're not too high, because what that means is our body is fighting the infection, and our body is upping the temperature in our body to try to destroy the pathogens, or make it an environment where they can't survive, but an environment where our body cells still can survive. But again, if a fever lasts for too long or it gets too high, then that can be damaging to our body and to our brain cells and things too. So you have to monitor it, but a fever is a physiological reaction, and it's an important part of fighting off a sickness. Okay, what are some of the disorders of skin? There are a lot. We're just going to mention a few here. Many of these you've probably heard of. Athlete's foot, caused by a fungus. Impetigo, they may not be as familiar with this, but this is a bacterial infection common in young children. It's passed on from one person to another when you come into contact with someone that has the infection, mostly in young children though, and it leads to these little sores around the mouth, the diaper area, things like that. So that's impetigo. Candidiasis, which is a yeast infection. You've probably heard of it just as a yeast infection. It happens in moist areas around the body. Eczema this is when your skin is inflamed. It can cause itching and things like that, an uncomfortable situation. Dandruff. You've all heard of dandruff. That's when your skin cells are sloughing off and because of dry scalp. And then urticaria, commonly known as hives, is an allergic reaction which causes little bumps on our skin. So there's a number of things that can happen. Any of these situations means that there's some break from homeostasis. There's something going on that has to be addressed. I want to talk more in depth about skin cancer, because this is something that can be very dangerous. The other disorders that we just looked at mostly are uncomfortable but not necessarily life-threatening. However, skin cancer can be. There's three main types that I want to touch on: basal cell carcinoma, squamous cell carcinoma, and melanoma, and then melanoma itself. Now the first two are non-melanoma cancers. They are not as dangerous generally. They can be taken care of, and they will not what we call metastasize. Now metastasis is when the cancer will spread around the body. That's why melanoma is so dangerous, is because it does metastasize, and so it can quickly spread and cause a lot of problems. These other two are generally just going to be localized to the skin. And you can tell where they happen: the basal cell, squamous cell. So these are both in the epidermal layer that's becoming cancerous. Melanoma is cancer of the melanin-producing cells in our body. All of these cancers, though, start with some sort of mutation, generally going to be caused by multiple mutations, and generally going to be caused by mutations from UV radiation exposure in our skin. So when you are in the sun, the UV radiation is actually penetrating your cells, going into your nucleus and causing mutations in your DNA. And so that's what melanin's job is to cover the nucleus with a pigment that protects it from that UV radiation. So basal cell carcinoma, this is the most common type. It forms little tumors in the basal cells, an open sore that will not heal, recurring reddish patch, smooth circular growth with a raised edge, shiny bump, pale mark, and comes in lots of different variations, but those are some of the signs there. And generally, you can just remove it, and that cancer will go away. So that's the basal cell carcinoma. Squamous cell carcinoma is more dangerous. So this potentially can lead to death if it starts to spread around the body. Also caused by UV exposure, but it is less common than basal cell. But similar type of symptoms as what you see in basal cell. And this is what it might look like here. And then finally we have melanoma. This is more likely to be malignant. If it is malignant, it can lead to complications very quickly. It starts in the melanocytes, which produce melanin. It looks like a mole on your body, but it doesn't look normal. And so there's moles, and then there's melanoma. Most common in fair-skinned people who have experienced a severe sunburn, and it's becoming more common, unfortunately. So so the question is, so how do you know if you have melanoma? So if you have a mole, how do you know it's just a mole, or how do you know if it's melanoma? So there are some rules to look at. You can see this picture of melanoma doesn't look right. I mean, it looks like there might be a problem. But what we do is we use what's called the ABCDE rule when you're trying to decide if something is melanoma or if it's just a mole. So they recommend that you look over your body every so often and look at your moles and look for these signs. So if you have a mole that's asymmetrical, meaning instead of being round, it's going to have some sort of irregular shape, that's a sign. If the border is irregular, or if it has notches, indentations, or anything like that, if the color is not even, so you have lots of different, so you see this discoloration, it's all not an even color throughout this mole here. If the diameter is greater than 6 millimeters, so that's about the size of a pencil eraser, if it's bigger than that, then that can lead to concern. And if it's changing, so if you've noticed, you looked at your mole a few weeks ago, now you're looking at it and it's starting to change and become a little bit different. So if you are answering yes to any of these, then you'd want to go in and get that mole checked out. It's better to, if you're worried about it, it's better to get it checked out than not, of course. So, but if you have any of these signs or symptoms, then go in and see a dermatologist and let them check out your mole. Skin cancer can be prevented using sunscreen, protective clothing, UV sunglasses, stay out of the sun during the worst times of the day, don't go to tanning salons and things like that. So try to keep your skin healthy. There is another type of skin cancer that it's Kaposi sarcoma, and this is found generally in AIDS patients. So this is somebody that has their immune system has been compromised, and then this can kind of take hold. So it's called an opportunistic skin cancer. Then we already talked a little bit about moles. Moles are just places where, if it's not melanoma, moles are just places where the melanocytes are extra active. Not a problem as long as it's not melanoma. And then warts are caused by a virus. So those are some other skin conditions that we can have. Wound healing. What happens if we get hurt? How does this get fixed? So whenever we have a wound, there's an inflammatory response. We're going to get redness, we're going to get swelling, we're going to get heat, and we're going to get pain. And all four of these things are important to that healing process. So when we get a wound, what happens first is blood fills the wound, and that's important because it can help get rid of the pathogens that will be, I guess, in that wound. And it starts to form a clot as that blood comes in contact with the ragged edge of the wound. Then that starts to lead to the clotting process. It also brings white blood cells, which are there to help to attack the pathogens and things like that. We get fibroblasts that move into the area. The fibroblasts, their job is to pull that wound together and to promote the regeneration of the tissue. And then our basal cell of the epidermis starts to produce new cells to replace those that have been damaged and lost. And then we can sometimes end up with a scar as the fibroblasts start to grow and fill in that spot. So here's some pictures from your books. You see the wound here, and then the blood fills in that area, and then you start to form that clot and the scab, and then the epidermal cells start to proliferate and replace themselves, and then you get those fibroblasts causing a scar below that area. And then finally we have burns. So burns can be caused by a number of different things, and often we think of heat or sunburns and things like that, but radioactivity, chemicals can cause a burn, or electrical agents can cause a burn as well. In general though, the depth of the burn and the extent of the burn, that's what's going to determine how bad the burn is. So we have different levels. We have first degree and second degree. So first degree means that just the outer layer of the skin, the epidermis, has been burned, and that's it. This kind is very painful because the nerves underneath in the dermal layer have been stimulated. So there's redness, there's pain, but you don't have any blisters, you don't have any swelling. It just hurts. It can be sore and painful. Now second degree burn means that the epidermis and the dermis, the dermal layer, have been burned. And you know that it's a second degree burn because you get blistering. And what's happening there is the epidermal layer and the dermal layer are starting to separate and fill with fluid, and so you get these blisters that are forming there. Also very, very painful because again the dermal layer with the nerve endings, that's going to be stimulated, and so you're going to feel a lot of pain there. Third degree burn. Now this is a full thickness burn, and it destroys both all of the epidermis and the dermis. The interesting thing here is that initially you're not going to feel any pain, and the reason is because that burn has destroyed the nerve endings in your dermal layer. And so, I don't know if that's a good thing, but it's not going to hurt initially when you have a third degree burn. But you're destroying your skin, going to be more dangerous. The surface of the wound is going to be leathery, maybe brown, tan, black, white, or red in this situation. And then we have a fourth degree burn where you've burned your tissues all the way down to the bone, very severe. So that's the first thing, which is the depth of the burn. And then we look at the extent of the burn. And we have something called the rule of nines when we're trying to estimate how badly somebody has been burned. So, but what we do is we separate the body into portions. So each arm makes up 9%, the head is 9%, each of the legs are 18%, and 36% is the chest and abdomen area. So this is both sides of the arms, both sides of the chest and abdomen, both sides of the legs, etc. If you add those up, you get to 99, and then just the genital region makes up the last 1%. So what we do to decide if a burn is critical or not, if you have a second degree burn that covers 25% or more of the patient's body, then that's critical. A third degree burn only has to cover 10%. So in other words, if one arm has a third degree burn, then you need to go into the hospital. If just half of a leg has third degree burn, then you need to go into the hospital. Any of the portion of the body has a fourth degree burn, that's critical. And then if a third degree burn occurs on the face, the hands, or the feet, then that's considered critical. You need to go in and get medical treatment. The biggest thing that causes problems in people when they're burned is the fluid loss, because our skin, one of its major jobs is that waterproofing, keeping the water in our body. So once that skin is removed, all that water now has a place to exit the body. So fluid loss is a big thing with somebody that has been burned. And then heat loss is important, and then bacterial infection catches hold, because now we have no protection against those pathogens getting in. So initially they're trying to keep an individual from losing too much fluid, and then they really have to monitor the bacterial infection so that individual stays healthy and is able to recover from the burns. Okay, so those are some of the disorders. The last thing I want to mention here is homeostasis, because the integumentary system is so important in interacting with other organ systems. It interacts with the lymphatic system, which is our immune system in protection. It interacts with the water balance, which is our kidneys. The skeletal system, because that vitamin D that we talked about, this helps our body absorb calcium and keep calcium. It helps our nervous system because our skin is where we receive all all the information from our outside environment. They're able to use to make decisions. The muscular system and the body temperature. So the skin and the muscles are what help maintain our body temperature. And it receives help from the cardiovascular system in the form of blood, the respiratory system for oxygen, and then the digestive and renal system is helping to bring nutrients to our skin and keep it healthy. It responds to endocrine hormones and assists in reproduction. So all of these things are associated with the skin. So that's chapter 5. So a lot of good information there. If you have any questions, let me know.